A new study has reported a now banned medical procedure using human growth hormone may have caused some patients to develop neurological symptoms of Alzheimer's. The study authors now suggest the patients are the first cases of Alzheimer's caused by a medical treatment. Joining us to talk about this, other health topics today, Dr. Bill Hartman, clinical trialist at UW Health. All right, doctor. We don't have all day. I think I could spend the rest of the show just talking about this study because it's so fascinating. But let's talk about the possible revelation of Alzheimer's disease. So in short, and correct me if I'm wrong, there was this trial gone wrong that happened back in the 60s, 70s, part of the 80s that used human growth hormones to try and make short people tall. And a lot of bad things happened to these poor people, including some developing Alzheimer's disease. So what does the new research about what happened to these people show?
So this is research that came out of London that was looking back at these people to see what lessons could be learned from this clinical trial to make the trial useful. And what they found was that these 2,000 people that received these multiple human growth hormone injections, and these injections were made by extracting human growth hormone from the pituitary glands of people who had died, so cadavers. They took this, injected it into people who required treatment for their short stature, and bad things happened. The trial itself was stopped in 1985 when it was found that prions were being transmitted from one person into another. This happened to 5 different people. And it caused these people to develop a disease similar to mad cow disease.
And now what's the link with Alzheimer's disease? Because does it reveal something that's now helpful for us today?
So it was interesting because some of the people in this trial developed Alzheimer's as early as 38. And these young people that develop Alzheimer's disease usually have genetic predisposition to it. These people had no genetic predisposition, so they assumed that this was iatrogenic or caused by this injection that they were given. The presumption is that the amyloid that helps develop Alzheimer's in people as they get older was also injected along with the human growth hormone, and that this amyloid, when it gets into the brain, causes these prion proteins within the brain to abnormally fold and leads to the development of Alzheimer's. And so these were the first cases, and luckily, likely the only cases right now known to be caused of Alzheimer's to be caused by a treatment from a doctor to a patient.
Yeah, let's hope that never happens again. And in short, let's hope if anything good came out of this is that we are getting a better of an understanding of a disease that so many are affected by, and we still don't really know a single cause for it. Let's quickly move on here because speaking of Alzheimer's, there was a drug that just got removed. It's being discontinued by the drug maker. What's going on here?
Right, this is Aduhelm from the drug maker Biogen, and it's being discontinued now so that they can put their resources towards the development of new Alzheimer's treatments. And it's got an interesting history. The drug was actually almost pulled in 2019 because an independent committee found that it was likely to be ineffective in the treatment of Alzheimer's. But Biogen and the FDA got together and said that this was an area of need, and to try to accelerate the approval of this drug, looked at doing this further study of Aduhelm. At this point, Aduhelm is a very, very small part of the market. Medicare never agreed to pay for it, and so it's not being used by a lot of people, so it shouldn't have a great effect throughout the Alzheimer's population in our country.
Yeah, possibly a setback there, though. But I think just this conversation with you shows what a sign it is about the research that is happening out there, and hopefully soon there will be a major breakthrough. Dr. Bill Hartman, appreciate your time.